last year when we did the psychologist compact. So this is just catching up with that, allowing them to do background checks for psychologists. And then there's the language about naturopaths that Tim will take us through. And then the final thing on our amendment that I think particularly you would be interested in, Madam Chair, is some language about the funding structure of OPR and asking them for a report back to us on how OPR is funded, because of the challenges they're having with the compacts, and also the sort of siloed nature of the fees they get from professions and the cost of enforcement. So they're going to report back to us next year, and the report would come to it would come to the GovOps committees. So if you would like it to come to this committee as well.
I think we'll look at it. If once it comes in, we'll need to tackle everything.
Yeah. Okay, and then the naturopathic language in it was, which Tim can go into the details, but the naturopathic physicians over many years have been asking for the ability to do some of the duties and that other physicians do, and it's been challenging for them to get this done. But we had everybody in the Department of Health, the naturopathic physicians, the medical society into the GovOps to testify, and then they all met separately and came to an agreement on the language that you see in the bill. So.
And I want to say thank you for doing that, because I know we had Heather Shoulders come in and the naturopaths come in to talk a little bit with us, and then sent that off to GovOps, and we're very thankful that you did that work. Would have filled up our agenda more than we could.
Yeah.
Right. So
Yeah, they did the work, and OPR was number 2 as well. So
why don't we look at that language, and then we'll hear from
yeah.
Thank you very much for having me, committee members. For the record, my name is Tim Devlin, legislative counsel. And let's see, turning to page 2 of the document that's listed on the webpage of my name.
So we have pretty good directions. Sorry.
Oh, sorry. Oh, it should be draft number 1.32 H70, which is an amendment offered by the Government Operations Committee of the Senate. And it's a few instances of amendment. We'll skip down to the second, which is at the top of page 2. And this is the portion of the amendment that has to do with naturopathic physicians. So this will create 3 new sections to be 2A, 2B, 2C, along with the reader assistance heading naturopathic physicians. So the first amendment will be to, this is in section 2A, we added by this. First amendment will be to Title 18 VSA, section 4999, this definition section, really looking at the, just for short context, this would be the vital records, general, and the health type VSA. This will add to the definition, pre-existing definition of licensed healthcare professionals. It qualifies it saying, as used in 18 VSA, chapter 107, means a physician assistant, adding the text, a naturopathic physician, or an advanced registered nurse. And then it will not affect the other definitions there. Section 2B will amend title.
Can you explain what that does by adding that to that
Oh,
definition?
sure, yes. So here we have birth certificates, and then by implication, this would enable naturopathic physicians to issue death certificates as well.
It doesn't look like it does that. That confused our committee, so that's why I wanted to make sure that you understood what that did.
The next section 2B, which are the birth certificates now, and this is to be modified. Title 18 VSA, section 5071, title birth certificates, who to make return. And in section A of that, we have similar insertion of language regarding naturopathic physicians to the already rated list of other medical practitioners. So this would read, on or before the 5th business day of each live birth that occurs in the state, the attending physician or designee, naturopathic physician or designee, or midwife, or if no attending physician or designee, naturopathic physician or designee, or midwife is present, parent or child, a legal guardian and mother under 18, register, report the birth, the form and manner prescribed by the state registrar. Then the remaining part of the sections are changed. Now turning to the new section 2C, having to do with the creation of the Naturopathic Physicians Technical Advisory Group. And on or before September 1st, 2024, the Commissioner of the Vermont Department of Public Health, or designee, shall convene the first meeting of the Naturopathic Physicians Technical Advisory Group. The Technical Advisory Group shall discuss the potential integration of naturopathic physicians into statewide policies regarding Vermont's patient choice life laws, do not resuscitate orders and advanced directives, and the creation of clinician orders for life-sustaining treatment. The Technical Advisory Group shall also consider the requirements of integrating naturopathic physicians into state policies as well. The commissioner of the Department of Vermont, Department of Health, shall chair the meetings. Then the following individuals and entities shall be invited to participate in an A meeting or meetings plural, described in the section, and then we have a listing of entities that will be invited to participate, including the Association of Accredited Neuropathic Medical Colleges, the Office of Professional Regulation, Patient Choices Vermont, Vermont Association of Naturopathic Physicians, the Vermont Ethics Network, the Vermont Medical Society, and other entities as needed related to naturopathic medical education. Catch all, yeah. And then reporting requirement. Sorry.
Yeah, just curious.
Yeah.
What's the goal of the advisory group? And is there a precedent with other? Is there other precedent that requires this group to be legislatively formed as opposed to forming their own group?
Can I answer that? So this group so there were other things that the naturopathic physicians were interested in being able to do, including do not resuscitate orders and COLS orders, which I can't remember what that means, and also to participate in the sort of end of life choices. And that requires a longer conversation and also a conversation about what training may be necessary or maybe they already have and sort of understanding their training. So actually this group that got together requested that we form this group so that there would be a sort of mandate for them to work out these issues and come back to us with recommendations about, because this is about a conversation about the scope of practice that's allowed under law for these types of providers. And so it really needs to have a robust conversation. And so this group would consider that. And this is the kind of thing that happens all the time. And I think Lauren can speak to that more, maybe more the medical society about, what is it that we want these professions to be able to do under the law. And so it wasn't an easy thing you could just put in the bill. So they wanted to have this kind of group.
Yeah, these are not the kinds of things that you can do ad hoc. You really need to have all these people in the room together. So the clinical order for life-sustaining treatment, do not resuscitate, those things are critical in terms of scope of practice and involve ethical decision making. So that's why the group is structured in that way. And they're currently the folks who make those orders are medical MDs and not the naturopathic physicians also have some training, but they may need additional continuing medical education training in order to participate. So this, I see this as really an important discussion for 2 reasons. the outcomes, but it puts people together with knowledge you can share.
So the next subsection here regarding this technical advisory group has to do with the reporting requirement. So the commissioner of the Department of Health is tasked with providing recommendations based on the work of the technical advisory group on or before December 1st, 2024, so that was close to the end of this year. And those recommendations will be provided to the House Committee on Healthcare, the Senate Committee on Health and Welfare, the House Committee on Government Operations and Military Affairs, the Senate Committee on Government Operations. And then, as CODA, the technical advisory group shall cease to exist on December 31st, 2024, which is the housekeeping to make sure that the groups that are created also cease. And that wraps up the portions related to naturopathic physicians.
That's helpful, and we did have folks in here and thank heavens that went off to GovOps to do some reverse, and thank you for those questions for Tim. Okay, so we'll bring Lauren up and hear from OPR. Yes. Yeah.
Here, hi. Language. Good morning, my name is Lauren Lee, I'm General Counsel for the Office of Professional Regulation. I'm really here to answer any questions you have. I think Tim walked through it very well. There's, under the OPR, we regulate and license naturopaths. Under that title, Title 26, under that chapter of Title 26, it says, for purposes of reporting communicable diseases and vital records, we defer to the other laws of the state. We pretty much pointedly say this is Title 18, this is Department of Health, they're the public health experts. So it's really in their space of this to determine who can and should report and how they do these things. So for our purposes, we're highly deferential to the Department of Health in this space, and if they're comfortable with this amended language for those statistical vital records, which they are, they're part of this meeting, then OPR is what the language. The current modification is specific to what the structure of the Title 18 is. It starts with kind of general applicability to vital records, then addresses birth certificates, and birth certificate language. It lists out all the professions that are allowed to report birth certificates. And then it has a death certificate section, and it just refers to licensed healthcare professionals and refers back to a definition in that general section. So for purposes of PR's work and clarification, we really wanted to make sure that it was clear that the intent was to modify the definition of licensed healthcare professional for this purpose, because that term is used in different ways throughout the statutes. So you'll see that it is very clear in there that this is licensed healthcare professionals, includes naturopathic physicians for the purposes of the reporting death certificates. We work with Department of Health, the Vermont Association of Naturopathic Physicians, or the Vermont Medical Society, Vermont Ethics Network, Patients Choice Vermont. Thank you to Heather for convening that meeting, and thank you for all the taking this language.
Oh, it's nice when things all come together. It's great. Thank you. Questions for Lauren? So in terms of the work going forward, you're all in on that?
Yes, we'll be there. I think again, it is with regard to the CULS, the DNRs, the end of life choices. Again, it's really a public health, Department of Health, and we're there to support any way we can with regard to OPR function in that space.
So you use the term calls as well.
Yeah.
Can you define
The
concept?
I'm gonna defer all of
Life-sustaining treatment.
life sustaining.
Right, so it's when you want to put someone on a respirator and how long will they last, you're doing the EEG and they're flatline.
You can choose.
So
which
safety is not
interventions in
stroke
advance.
develop.
Yeah. After a while, you hear it enough, to remember it, it just popped into my head.
Yeah, that was good.
Yeah.
I was like, I used to know this.
Yeah, I know.
can't think of it.
I know what it does, I can't tell you that.
Yeah.
Right, as we get. Any other comments that folks would like to make before we call it a wrap for the day? We're good. Thank you all for being here. Appreciate it. This is something that honestly has been hanging over me for a long time. And I'm glad that we've been able to resolve it the way we have. So appreciate all the work that's been done on this.